for these groups is often due to decreased muscle tone, impaired mobility, and impaired lung function, such as the inability to cough effectively. People with disabilities who have limited mobility may be unable to avoid contact with others who may become infected. Some people with disabilities may have family members or other formal caregivers, such as direct support providers, who assist with daily living tasks and who introduce more opportunity for exposure to respiratory illnesses when they are circulating in the community. And some people with disabilities may have trouble understanding or practicing prevention measures, such as hand washing, and may be unable to communicate if they're sick. For example, people who are deaf or blind may struggle to find or receive health recommendations in accessible formats. Next slide, please. So people with disabilities need to protect themselves from respiratory illness. And the best way to do this, to prevent seasonal flu, is to get vaccinated each and every year. The Advisory Committee on Immunization Practices routinely recommends that all persons aged 6 months or older receive flu vaccine every year. They also emphasize the importance of vaccinating populations at higher risk for complications due to severe flu, including older adults, adults and children with medical conditions such as cardiovascular disease, diabetes, or obesity, and those with neurological disorders, and also residents of long-term care facilities. CDC typically recommends that people get a flu vaccine by the end of October. However, flu vaccination should continue to be offered throughout the flu season, even into January or later. And getting a flu vaccine this winter is more important than ever because of the ongoing COVID-19 pandemic, to help protect against flu-related complications and to save scarce medical resources. Flu vaccination is especially important for people who are at high risk from flu, many of whom are also at high risk for COVID-19 serious outcomes. The COVID-19 pandemic has obviously stressed our healthcare system quite a bit, disrupted routine outpatient care, and caused an increase in hospitalization rates throughout the US. To mitigate the impact of the increased number of respiratory viruses expected this winter, it's essential that key prevention measures continue. The current recommendations for slowing the spread of COVID-19, namely hand washing, social distancing, use of masks when around others, and cleaning and disinfecting frequently touched surfaces, should also help reduce the spread of flu. However, flu vaccination remains the most effective means of reducing illness, including hospitalization and death from flu. With the prospect of co-circulation of SARS-CoV-2, the virus that causes COVID-19, and seasonal flu, strategies to maximize flu vaccination are therefore essential to conserve healthcare resources, such as PPE or personal protective equipment for healthcare workers, hospital beds, and mechanical ventilators so that they're available to persons who are hospitalized with COVID-19. Next slide, please. So flu vaccines overall are quite safe. They have a tremendously good safety record. Hundreds of millions of Americans have safely received flu vaccines over the past 50 years. And there has been extensive research supporting the safety of flu vaccines. However, like any medical product, vaccines can cause side effects. Side effects of the flu vaccine are generally mild and go away on their own within a few days. Common side effects from the flu shot include soreness, redness, and swelling from the shot, headache, fever, nausea, and potentially muscle aches as well. A flu vaccine is the first and best way to reduce your chances of getting the flu and spreading it to others. And as mentioned before, CDC recommends that everyone 6 months of age and older receive a flu vaccine every year. Next slide, please. So let's chat briefly about the benefits of a flu vaccine, right? So flu vaccination can keep you from getting sick with the flu, right? This prevents millions of illnesses each year and many flu-related doctor's visits and hospitalizations each year as well. And it's important to understand that flu vaccination is an important preventive tool for people with chronic health conditions, including those with disabilities. And flu vaccination has really been shown in several studies to reduce the severity of illness in people who do get sick even after they get vaccinated. So you may hear some people say, oh, well, I got the flu vaccine this year, but I still got the flu. But hopefully those people may not have gotten as sick as they would have been if they hadn't been vaccinated. So perhaps they got vaccinated but still got the flu and had a mild illness instead of having severe illness and needing to be hospitalized. It's also important to remember that getting vaccinated not only can help protect yourself, but also the people around you, right? And sometimes there are people in our families, friends, or people who we work with who can't get vaccinated or who perhaps are particularly vulnerable to flu. And by getting yourself vaccinated, you can help protect those. And some of you may know about this concept of cocooning. So babies oftentimes cannot get certain types of vaccinations until they reach a certain age. As we mentioned, babies can't get flu vaccine until they're 6 months of age. And so it's important when a mother is pregnant that mother and everyone in the family get vaccinated against flu and pertussis to help protect that baby until they're old enough to receive those appropriate vaccines. So the same concept applies here when we're talking about flu and people who are at a higher risk of complications from flu. Next slide, please. So like many vaccines, there are some misconceptions out there about flu vaccines. And we've just put some of the more commonly asked questions and some of the more commonly proposed misconceptions about the flu vaccine on this particular slide. And one of the most common ones is, can a flu vaccine give you flu? And the quick answer is no, it does not. So depending on which type of flu vaccine you get, there are certain types, each of these vaccines is made in a different manner. So the flu shots, the ones that are given by a needle, are made with inactivated or killed viruses, right? And so those killed viruses cannot cause you to have actual flu. And the nose spray does contain live viruses, but these are weakened. So in the lab, they're able to weaken those viruses, so they won't cause actual flu, but they will still cause the body to have that immune reaction to allow you to be immunized against flu for that year. So regardless of which type of flu vaccine you get, neither of them should cause you to actually get the flu illness itself. Another question that we often hear is, isn't it better just to get sick from the flu than to get a flu vaccine itself? And once again, the answer here is no as well. As we've stated before, flu illness can be a very serious disease. Even if you don't have any of these underlying chronic medical conditions, even if you don't have a disability, it can cause people who are healthy to be very sick, be hospitalized, and even die. We know, unfortunately, year to year, there are approximately 100 or 150 children who die every year because of flu in the US. And somewhere around half of those may actually not have any underlying medical condition, right? So it just highlights the importance of everyone getting vaccinated for flu. And the third one here is, do I really need a flu vaccine every year? And the answer here is yes. CDC recommends that everyone get a flu vaccine every year, right? And this is for a variety of reasons, one of which is that a person's immune system from vaccination declines over time. And so it really is optimal to get that flu vaccine every single year. Next slide, please. So treatment for flu. Fortunately, there are some treatments for flu. We know there's great vaccines to help prevent flu, but there are also treatments that we can use to help shorten the illness and potentially help decrease the severity of flu as well. And there are antiviral drugs that can treat the flu illness. These drugs are different than antibiotics, and they're not over the counter, so they do require a prescription. So what's the benefit of taking these antiviral, anti-flu medications? Well, they can really make the illness milder, so not as severe, and can also shorten the time that you are sick, right? And so hopefully they can help prevent some serious flu complications like pneumonia or lung infection when the treatment is started early. And so this is a key message here. It's very, very, very important that when antivirals are used, they're started as early as possible. And if you look at the studies, most of them will show that the benefit for these antiviral, these anti-flu medications are really within the first 24 or 48 hours of when someone gets sick. So if you have one of these underlying medical conditions, if you have a disability and you think you may have flu, it's important to seek care as quickly as possible so that in case you do need one of these medications, that those medications can be started as soon as possible. Next slide, please. So here we just wanted to just discuss briefly some other important flu prevention actions, right? We're highlighting the fact that the flu vaccine is the most important step that you can take. But also, I think it's important to talk about these other flu prevention actions, right? And you'll see that many of these are the same ones that we're recommending for COVID-19. So obviously avoiding close contact with people who are sick. So if you yourself are sick, try to stay away from others as much as possible. And if any of your family members are sick or caregivers, have them stay away from you as much as possible as well. And it's just, if you are sick, once again, just try to limit contact with others as much as possible. When you do cough or sneeze, cover your nose and mouth with a tissue and then throw that tissue away after you use it. And I think this is obviously one of our key messages whenever we're talking about any type of infection, but wash your hands often with soap and water. If you don't have soap and water readily available, then use one of the alcohol-based hand sanitizers. And try to avoid touching your eyes, nose, and mouth as much as possible. And if you're wearing a mask, try to avoid touching your mask as well when you're around others. And just once again, try to clean and disinfect frequently touched surfaces as much as possible, as frequently as possible. Next slide, please. Alrighty, so we just wanted to highlight one of the great resources that some of our colleagues here in CDC have created, and it's a website called Vaccine Finder. You see the website address right there. It's vaccinefinder.org. And this is a website that really makes it simple to find a nearby location to receive a vaccine. What you can do is once you go to the website, you can simply select the type of vaccine that you need. So in this case, we're talking about flu vaccines. So you would just select the flu vaccine based on your age, entering your zip code, and then click search. And the results display, as you see here in the bottom left-hand corner of the slide, in a map and list format in the order of distance from the zip code that you entered. So it's really a tremendous resource and super useful, and we recommend that you look at it when you have the chance. Next slide, please. And that's it for me. Thank you so much.
Thank you so much, Dr. Stevens. Up next, we have Dr. Matt Holder. Dr. Matt Holder, as an international leader in the emerging field of developmental medicine, Dr. Matthew Holder advocates on behalf of people with intellectual and developmental disabilities for better quality health services. Dr. Holder currently serves as the Global Medical Advisor Chairman of the Medical Advisory Committee for Special Olympics International. He is a co-founder and past president emeritus of the American Academy of Developmental Medicine and Dentistry, president of the American Board of Developmental Medicine, and is the chief executive officer of the Lee Specialty Clinic in Louisville, Kentucky, an interdisciplinary teaching and research clinic whose mission is to address the health needs of patients with intellectual and developmental disabilities. As a physician, educator, and healthcare advocate, Dr. Holder has impacted the state of healthcare policy, research, and medical education around the world. Dr. Holder?
Oops. False start there. Thank you, Kara. So let's, I wanted to just start off and focus on people with intellectual and developmental disabilities. I believe a little bit later we're going to have a slide on resources, but if we don't, I just wanted to mention that on the Special Olympics website, there is a resource around influenza vaccine that is geared toward people with intellectual disabilities. So I recommend checking that out. Really, I want to start off by saying why people with intellectual disabilities really need to get a vaccine and should go and get a vaccine today. This table for me really tells the story, and I'll explain it. If you look at the graph here, I'm really showing you two different populations. The red bars are the general population, and the blue bars are people with intellectual and developmental disabilities. And what we know, what we're looking at here is if you look at the percentage of all people who die, what we're looking at is, you can see the general population, about 30% of people will die at the age of about 85 or older. 25%-ish will die between 75 and 85, and it sort of goes down. With people with intellectual disabilities, this is different. The peak age at which people with intellectual and developmental disabilities die is between the ages of 55 and 64. And so this contributes to their very significantly shortened lifespan. But, and there's a lot of reasons for this, but I think the most important one, let's go to the next slide. The most important reason for this is this statistic right here, which is that 1 in 4 people with intellectual and developmental disabilities will die due to a respiratory illness. And so I think that if you add up all the different diseases that people will die from who have intellectual disability, about 25% of those are respiratory in nature. Now, that is one of the major reasons why we see this early death in this population. So what that's basically telling us is that we have a group of people here who have a compromised, or at least a good portion of them have a compromised respiratory system. And of course, what is the big worry with the flu, with influenza? There could be hospital stays and doctor visits and those things, but it can transform into a significant respiratory disease. It can transform into pneumonia, and in people who have a weakened state and who are predisposed to die because of a respiratory illness, we want to make sure that we're not increasing those odds. So in my mind, this is a spectacular reason to get the flu vaccine if you or somebody you know has an intellectual disability. Next slide, please. Of course, it's 2020, and the thing on everybody's mind is COVID-19. Now, of course, the flu is completely different from COVID-19. Getting the flu vaccine is not the COVID-19 vaccine, but here's the thing for people with intellectual disabilities. We know from some of the literature that the case fatality rate for people with IDD could be as high as 15%. That's a very significant rate. I've certainly seen some studies that are lower, but in pretty much every study that I've seen that focuses on people with intellectual disabilities, the case fatality rate is higher than it is for the general population. So we have a high risk of dying from COVID if we have intellectual and developmental disabilities just in general. And why is that important? Well, if you have the flu, the next possible thing that could happen is you're going to go to the physician's office, you might go to the hospital, you might go to an ER. And in my experience, in our experience at our clinic, if somebody with IDD doesn't have COVID brought to them by a caregiver or somebody close to them, the next most likely place that we've seen it is in the healthcare setting. So by getting the flu vaccine, you're also reducing the odds that you are going to need to interface with the healthcare system at all. And especially in high acute areas of the healthcare system, like an emergency room, where you might be exposed to COVID-19. So for me, this is just an extra reason, especially now, to get the flu vaccine, because it just helps us prevent another potential reason for going deeper into the healthcare system and potentially being exposed to COVID-19. Next slide, please. I just want to hit a couple of more points. First thing is that people with IDD tend to have more close contact with people. And so this puts them at a higher risk of developing really any kind of viral illness. These days, of course, there's a lot of PPE and things like that, but the fact is there's just more close contact in general if you are part of the IDD population. So for that reason, it's very important for people who are around people with IDD, this concept of cocooning, to also be vaccinated or to get vaccinated. So family members, direct support professionals, and anybody really who has close contact with people with IDD should get vaccinated. As Dr. Stevens mentioned, the vaccine is very safe. So, you know, there's a lot of myths around there, and I hear some very funny stories sometimes about things that people are worried about. But the vaccine really, truly is very safe, and so it's not something that the risk pretty much always outweighs the benefit. And in our experience, at least at our clinic, what we've seen, which is really heartening and very nice, is that people with ID and their caregivers really want to get the flu vaccine this year. I think the word is out. I think people are, this heightened awareness because of COVID And because of the link between the healthcare resources and all of the marketing and messaging that's out there around the vaccines and the flu vaccine, I think people are just a lot more conscious of it. So we're getting a lot more requests right now than we ever have for the flu vaccine, which I think is wonderful. But I think that's a very good point. The last thing I want to talk about is, and next slide, please. The last thing I want to talk about is the idea of informed consent. So this is, anytime we work with people with ID, I tend to err on the side of getting informed consent. Now, at the federal level, there really is no legal requirement that I'm aware of, and I think even on the CDC website it says this, that there is no requirement for informed consent for a vaccine. But of course, you should check with your local health departments, your state regulations, and even your facility regulations to see if that's the case. Now, I tend to always err on the side of informed consent when I'm doing something like this with somebody with IDD. I just think it's the best practice. And sometimes clinicians and physicians are a little bit unsure of how to get informed consent. They might be confused by somebody with intellectual disabilities method of communication, or not understand whether they understand what's happening or not. So a tool that I like to use and I just would recommend for anybody is supported decision making. And it's very simple, but essentially what that means is if you're concerned that you may not be able to get informed consent from somebody that you're going to give a vaccine to, or you want to give a vaccine to, then utilize supported decision making. It's just a scenario where you invite somebody who's close to that person, perhaps it's a family member, a close caregiver, somebody that they trust, who can help you and explain to them and answer questions that they might have so that they can truly make an informed choice about this. Sometimes I've heard patients who have said, oh, well, I heard that this can make my muscle sore, so I don't want to have this vaccine. It's a very minor side effect and the benefit is significantly better than that, but it takes a little bit of explaining sometimes. So I would just encourage people to remember that when it comes to working with people with intellectual and developmental disabilities. And I guess the bottom line is here, folks, go out and get your flu vaccine. And with that, I'm going to turn it over to you, Kara. Thank you.
Thank you, Dr. Holt. Thank you. Up next, we have Chris Mackey. Chris is a senior project coordinator with the National Center on Health, Physical Activity, and Disability, also known as NCHPAD, at the Lakeshore Foundation in Birmingham, Alabama. In his role there, he leads NCHPAD's work targeting public health professionals, which includes initiatives on inclusive, healthy community design, diabetes prevention, emergency and public health preparedness, and general accessibility. Chris has a degree and training in therapeutic recreation and almost 20 years of professional experience working in the field of disability and health at local, state, and national levels. Chris?
Thank you so much, Kara. I appreciate it. So hello, everyone. Again, my name is Chris Mackey. I'm with, as Kara said, NCHPAD, which is a CDC-funded National Resource Center on Disability. At NCHPAD, we work from really a public health perspective, to remove barriers to health and wellness for people with disabilities. I'm kind of joining you today really in two capacities, both as an individual with a disability and as someone with, of course, a professional experience and knowledge in access and inclusion. I'll just take a few minutes to share some personal insights on today's topic and then take up a bit of a different angle from the other two speakers and touch on just a few broad strategies that individuals, families, and providers can try to address and remove barriers to access to care in general and specifically to flu vaccinations. Most importantly, I'll be sharing resources throughout the presentation that are directed to both providers and families to help them address really three of the more common and more significant barriers that people with disabilities face when trying to access preventative care. Next slide, please. Okay. Actually, can we go back one, please? Thank you. The original ask of the talk today was to offer a personal perspective, as I mentioned, and then talk about barriers to getting a flu vaccine, especially given the concerns that everyone has with the current COVID pandemic. For me personally, I have spina bifida, so I've had a disability and use crutches and a wheelchair my entire life. I'd say I've been very privileged when it came to health and wellness, though. I've had support of a family and a parent in particular who was a nurse practitioner, so information and knowledge and resources around taking care of myself and being an advocate for health came to me rather easily. I've had experiences in healthcare with the healthcare team where physicians and other providers took a whole person approach and looked at every kind of issue, every kind of health concern I might have, not just spina bifida. So what we know very often that people with disabilities automatically encounter a lack of attention to wellness issues and preventative care, like getting a flu vaccine. They face physical inaccessibility, inaccessible information that is also not inclusive. And now with COVID, many people are having to navigate receiving healthcare virtually, which can also be inaccessible. Next slide, please. So the resources noted here do focus both on both consumers and providers. They focus on COVID, but really demonstrate what accessible information related to getting a vaccine should look like. An added barrier now to obtaining care and preventative care is COVID anyway, so having digestible information about that topic is just as important. Listed here are a few resources for both providers and families. My organization, NCHPAD, has developed useful guidance for communicating health information to individuals with disabilities that providers may find useful. Additionally, most people with disabilities are familiar with and understand the importance and the concept of self-advocacy. The Self-Advocacy Resource and Technical Assistance Center can help individuals and families with developing self-advocacy skills and connecting to local organizations. And finally, there's a new project actually that's just a few months old out of Georgia Tech that created COVID information that is in accessible formats. That's a big barrier that many people with disabilities face, is getting information that is actually in a format that they can understand and digest. Also, I would echo Dr. Holder's mention of the Special Olympics and the resources that they have related to flu. Next slide, please. Transportation might be the most important issue really to talk about here. People may first kind of think that, especially if you're a provider, this topic is sort of out of their wheelhouse, but for many with people with disabilities and people who are belong to underserved communities, lack of transportation, is a very common barrier to receiving care. The National Aging and Disability Transportation Center has a great deal of connections, resources, and information on how transportation providers should be implementing protocols for COVID-19 so that transportation to medical appointments can be done in a safe way. NADTC can also be a connector to transportation resources in your area. One of the things you'll hear me say is that inclusion with people with disabilities starts with partnership, and particularly partnership with the disability community. And this includes accessing preventative health services. And there are community-based organizations across the country in every state, such as Centers for Independent Living, which I'm a huge proponent of, that can connect both individuals and providers. Whether you are a pharmacy, whether you belong to a regular doctor's office or the like, they can share transportation options for you or for your patients that might be available in your community. Next slide, please. This slide might lean a little bit more towards providers, but I think it's important to remember that access to care, meaning actually being able to get into a healthcare environment and obtain information and services, is a right for people with disabilities. Often providers unintentionally exclude people with disabilities from receiving care. And while a flu vaccine is a relatively simple issue to address, a relatively simple procedure, accessibility shouldn't ever be ignored. Oftentimes, inaccessible environments and healthcare environments in particular can turn a person off, if they have a disability, to getting preventative care. Next slide, please. So what's the formula for successful inclusion of people with disabilities in getting flu vaccinations and other kinds of preventative care? Inclusion happens through partnerships. And that's a mantra that I've already mentioned and I often use. It's a partnership between providers and the disability service community, and providers and patients with disabilities and their families. I realize in this short webinar, we only really scratched the surface of many of the issues that prevent people with disabilities from getting preventative care, and including flu vaccinations. And we're not talking about things like accessible telehealth or rural transportation, but I would say to individuals and families that are listening that information you need to be an informed consumer is out there. So please, please don't get discouraged. Next slide, please. So that is kind of the information that I wanted to present on today. This is my information, and I do invite you to visit the NCHPAD website. We have a lot of free information and resources related to a variety of health issues, and I will turn it back over to Kara.
Thank you so much, Chris, and thank you everyone else, Dr. Holder and Dr. Stevens, for presenting today. Let's see. So now we'll go ahead to the question and answer portion. Let me check the chat to see if there are any questions. If anyone has any questions, go ahead and feel free to put them in the chat. Okay, sorry, just going ahead to check. And I'm not seeing any questions here in the chat. Does anybody have any that they'd like to go ahead and add now? Okay, if not, let me go back and share. And here, like we kind of mentioned earlier, we do just have a list of resources. As Chris mentioned, there is NCHPAD's website. We do have a variety of resources related to several different health topics. And in the chat, I think at the very beginning of the chat, there's our flu fighter campaign. The next resource that you'll see listed on the screen is CDC's flu website. I encourage you to check that out. I'm sure there's tons of information as it relates to flu vaccines this year, and then how flu vaccines and COVID, how the COVID pandemic is impacting that. Vaccine finder that Dr. Stevens mentioned in his presentation about where to find a vaccine in your area, and there another resource listed here at the end. Okay, and with that, that's our webinar for today. If you have any other questions or information that you'd like to have, just visit ncpad.org or cdc.gov. Thank you all so much to all of our presenters and to all of our participants for joining today.